Welcome, welcome, welcome to Real Talk, Straight Talk. I am your host, Ivudi Bashengi, and we are back with part 2 of COVID-19, A Black Perspective. And as you can see, I have a special guest today. He was here last week, but he graced us with his presence in studio, so I'm super grateful. I'd like to present to you guys Medical Officer of Health, Chris Mackie. How are you, Chris?
I'm well. Thanks a lot for having me.
I am honored to have you here. Being able to take your time to come and answer the questions for our community, it means a lot for us at the studios, but also at the community. So thank you.
It's a pleasure.
Yeah, so I want to remind you all that you're able to chat as well as call in, ask questions, and again, we're talking about COVID-19, a Black perspective. So to start off, I want to ask you, what is your role and what do you do at the Health Unit?
Sure, so I'm the Medical Officer of Health, so I'm a public health physician, and I give medical leadership to all of the programs that we operate. The Middlesex London Health Unit has a wide range of programs, most of which have some aspect of prevention. So we have everything from more typical public health programs like outbreak and infectious disease management, where we support if a hospital or other facility has an outbreak going on, all the way to restaurant inspections, safe water programs. We have home visiting support to new families, healthy babies, healthy children. We have a large sexually transmitted infection program where we're helping people to manage those infections and get treated. So a broad range of things, and I provide medical leadership and support to all those programs.
Oh, that's awesome, that's awesome. Kemi was here last week, who's the head nurse at the Middlesex Health Unit, and she was able to speak about that program, Healthy Babies, Healthy Children, and it is amazing. You have to look that up. And so when I was doing a little bit of research on the Middlesex Health Unit, I also saw that. So you did speak about prevention and you promote healthy living. And so when it comes to promoting healthy living, and what means do you do that? Just when it comes to just even our community.
Sure. So there are a few ways. First of all, we try to develop government programs and policies that make the environment healthier for people. Tobacco is a great example where public health was behind a lot of the movement to restrict tobacco use so that it doesn't impact children, so that secondhand smoke doesn't make people sick in the workplace, that sort of thing, all the way to enforcing, making sure that people that are selling tobacco products aren't selling to minors. And then we also, in addition to working on the environment, trying to make it healthier, we work with people to try and help them to choose healthy behaviors, whether it's exercise or eating well or, taking care of your mental health, right. All those sorts of things. Right.
So that's where the prevention that you're talking about comes in.
Exactly.
Awesome, awesome. And so it also on your website talked about identifying the community needs. How do you do that?
Sure. So we do it two ways. One is through what we call population health assessment. So that's where we look at all of the hospital records, all of the death records, all of the data we have about our community, and we say, what is it that's making people sick? So what are the major illnesses and what are the causes of those illnesses, so that we can try and address those underlying causes. Right. So that's kind of population health assessment, a big overview of the health of your community. Mm-hmm. And the other way is surveillance, which is more immediate, where we're watching for emergence of things like infectious diseases. Right. But the overdose crisis is another example where surveillance has been really important. Right. With our partners, we can identify, is there a bad batch of drugs in the community that's causing a lot of deaths? Report out to the community, make sure people take, precautionary measures.
Right. And how has the Black community been considered when it comes to taking in this information, this data, this research? How has the Black community also been taken into account so that you're able to better help our community?
Yeah, I appreciate the question. We try very hard to identify different groups that have higher rates of illness or of the underlying causes of illness, whether it's poverty or housing conditions or whatever the cause may be. And of course, when we look at the data in Canada, you find a similar picture to other places in the world, like the United States, where people of color generally don't have access to the same healthy environments, may not have the resources or housing conditions or jobs, and so often experience a higher level of various types of illnesses. Now, we don't have data that is as high quality as in the U.S. There's a lot of gaps in the data here in Canada because we don't routinely ask, about race in all of our healthcare data. So we really have to try and fill the gaps there. But that's a big part of what we're trying to do.
Okay.
COVID is a good example. I know we're going to talk a bit more about that later.
Yes.
But we've seen here and in communities across Ontario that the rates of COVID have been higher in the Black community.
Okay.
A whole bunch of factors. Of course, housing conditions are crowding, concentration in urban environments where we know that can lead to easier spread of the illness.
Right.
Often frontline jobs, grocery store clerk, for example, that sees a lot of people face to face every day, can put people of color at higher risk.
Okay,
Yeah.
okay. Thank you for sharing that. So, and something else I know that I was looking at the website, it was talking about being working with politicians and decision makers to be able to create laws and guidelines so that we are able to have healthier communities. So in filling these gaps where you haven't been able to get the right numbers, the right information when it comes to the Black community, and I know last week we had spoken about the strategy that is trying to be created to be able to reach out to the Black community. So is that going to be taken into consideration in creating new guidelines, new laws, bylaws that specifically affect our community?
That's the intention, absolutely. And, one of the other things that we can't get from the health data is the values of the community. So, we can tell you what the top 10 causes of death might be, but we can't tell you whether a death in somebody who's elderly has the same value as a death in a young person, or, which of these do we believe are more equitable deaths, and where do we think there really is an injustice where the Black community wants us to do more work.
I love that. I love that because that means that there is progress within society. For a long time as Black people, we have been neglected and looked over and had to kind of like deal with the crumbs of the different establishments that we deal with. But here we are having a conversation with the leader, as we spoke of before, and here he is saying that he wants to know our values. He wants to know, where is it that there are these gaps? What is it that we need help with? So that is why we should be definitely connecting with the health unit, making sure that your concerns, are heard. So let's get into COVID-19.
Sure, let's do it.
So when it comes to the numbers, you're saying that COVID-19 is affecting a lot of people within the Black community. A lot of people are dying, getting contaminated with COVID-19. So where are these numbers coming from? How accurate are these numbers? Because I've had some people like, hey, are they just saying anyone that gets sick and has something else? Are they just considering it COVID? How do you know if someone is actually dying from COVID or they're dying because they had a weak immune system? Where are these numbers coming from, and how can we trust them? Yeah,
really good question. And there are lots of different parts to the answer. Let's start with where most of the diagnoses come from.
Okay.
So most of the people who are diagnosed with COVID get tested in one of the assessment centers. We have two large assessment centers in London. One's at Carling Heights Optimus Center, and the other is at Oak Ridge Arena. So that's where most people get tested, and most people who test positive would be identified there. And then the other place where many test results come from are healthcare facilities like hospitals or long-term care facilities. The testing that's done is standardized. It uses a PCR test, which is a genetic fingerprinting test that is very accurate. It is considered the gold standard testing. So if you go into assessment centers, you get that gold standard, best possible testing. The question of people who die with COVID versus people who die of COVID is another good question. It's a pretty broad definition. So if you test positive for COVID and it's considered to have any contribution to the death, for example, if you die of pneumonia but you had COVID at the time and it probably played a role, definitely a COVID death. We've had other people who are positive for COVID, they get, struck by a car or may die of suicide or that sort of thing, and clearly that's not a caused by COVID death, and so those people
But is that reflected within the numbers,
yes,
or is it all
absolutely.
put together?
Those people would not be counted if there's a
Okay.
clear cause of death that's not COVID.
Okay.
Sometimes it takes a lot of investigation. We have to wait
Yes.
for a coroner's investigation to determine what the true cause was. But if it's clear that the person, that died of something other than COVID, they would not get counted in the stats.
Okay, so we'll talk more about that. We have a caller. Thank you for calling Real Talk Straight Talk. Can you introduce yourself?
Hello, good evening. My name is Star.
Hello, Star. How are you?
I'm doing well. How are you?
I am wonderful. What's your question?
Well, I have a comment and a question. Just one about the numbers. As you were saying, the Black community has been more impacted by COVID, or there's been a higher infectious rate within the Black community. But I wonder, my comment is, I wonder if those numbers are skewed because sometimes being able to go and take a test becomes a privilege when you're working, on depending on where you work and how much leeway you have with your employer to take that time off to go and get tested. Also, when you consider who has childcare and who can pay for childcare. So I do wonder if those numbers would actually, are actually higher because I know there's like a lack of confidence, hesitation to go get tested, and then lack of opportunity to go get tested.
Right.
But my question was, and I'm not sure if you're able to answer, but my question was about the vaccine, because there was a pop-up clinic. I live in Toronto. There was a pop-up clinic in at a Caribbean community center, and so there was a pop-up there, and I was headed, unfortunately I couldn't get the vaccine. They ran out, but I was heading there, and I was so nervous about the vaccine because I was wondering about the trials and whether were we included in during the clinical trial.
Yeah.
So I wonder, is it possible that vaccines would have possibly different effects on Black bodies than what I'm assuming were white bodies that were, in the clinical trial process?
So some great points. First of all, on the data question, when we were able to gather data here in Middlesex and London, what we found is that the rate of COVID was about 20 to 30% higher among people of color. Other studies have shown even higher. If Public Health Ontario looked across the province, and they found that communities with higher ethnic diversity were overrepresented by a factor of 3 to 4 in terms of both hospitalizations and deaths. So really a tragic impact there. And I think you're absolutely right, Star, that the numbers coming from the testing centers probably underestimated that because there are barriers to many people being tested. On the research on the vaccines, there is lots of experience in people of color, well represented in the study populations. The two main studies for the Pfizer and Moderna vaccine each had about 40,000 participants, and those were from US, Brazil, and I believe Germany was a third country. But you had a lot of ethnic diversity in the US sample as well as the Brazilian sample, enough to say that there was definitely as good or better of an effect with the vaccines in people of color.
Okay, thank you. I appreciate that. It's as I compile, information and about my decision on whether to get the vaccine. What you said is definitely very helpful.
I'm really happy to hear that, Star.
And then I guess I did have one other question. Is have you noticed that across different races, whether there are differences in symptoms?
It's a good question. I'm not aware of a lot of systematically gathered data showing that there was different impacts. There are certain genetic issues that may be more prevalent in one population than another around how the immune system reacts. But as far as I know, there isn't a lot of good data to say that an individual case in a person of color would be any different than someone who were white or Asian.
Okay, thank you so much.
Okay. Thank you, Star. Those are very good questions. So since we already are on the topic of the vaccine, let's just get right into it. So what are our options when it comes to getting the vaccine? What are the different vaccines that are available?
So right now just two, and that's actually because there was an announcement today that the government's going to pause the third vaccine, AstraZeneca. Okay. They have had some cases of the blood clots in Ontario. It's very uncommon, still in the range of 1 in 100,000 vaccinees, right. But they've decided that now there's enough Pfizer and Moderna that they're going to put the AstraZeneca on hold for now. Okay. So those are your options, and the two vaccines are very similar, almost identical. Right. They're both what they call mRNA vaccines, so messenger RNA is the technology that's used for Pfizer and Moderna. And their study results are very similar. Both, even after one dose, both of them are around 90% effective. The second dose is mostly for maintaining the immunity longer. Both can generate, headaches, sore muscles, fever, that sort of thing, but it generally passes within a day or two. Otherwise, excellent vaccines. Okay.
And so are those the only side effects when it comes to both those vaccines? I know there's been a lot of talk about it, vaccine changing your DNA, others about just a lot of different things going on. Are those the only things that are when it comes to symptoms of taking the vaccine?
Yeah, so for the two mRNA vaccines, the main side effects are fever, sore muscles, that sort of thing. The mRNA vaccines do not change your DNA. Okay. They do not, some people have said that they want to get, some kind of superhuman DNA out of this. It doesn't happen. It doesn't change your DNA. It doesn't
Where do you think that comes from? Where do you think that, where did this come from, this whole idea of it? Why do people think that it would change your DNA?
Yeah, well, so the messenger RNA is a genetic material. RNA is like what viruses use for their DNA instead of DNA. And so the process does use that RNA to signal to your cell what to react to. Okay. So that may be where it's coming from, but there's no evidence of that. And again, these studies had 40,000 people in them. They looked very carefully for any kind of serious side effects. Didn't really see any.
Okay, thank you. So we have another caller.
I'm not on.
Thank you for calling Real Talk Straight Talk. Can you introduce yourself?
Oh, hello. Good evening. How are you?
I'm wonderful, thank you. How are you?
I'm all right.
Awesome. What's your question?
What's the question?
Or comment.
What's my question? My question is the vaccine, the first shot, is it the vaccine when you take the vaccine? Is it make you immune? And which one of the vaccines is the better one to take?
Yeah, great questions. The two that we're offering now, the Pfizer and Moderna, are both top of the line. Some people have argued that they're slightly better than AstraZeneca. I would still say if you get a chance to take that third one, take it. Johnson & Johnson is another one we'll have access to soon that's similar to AstraZeneca. But Pfizer and Moderna, definitely top of the line vaccines. If you can get them, that's where you should go for sure. And I'm not, sorry, I might have missed part of
the second one. He said, does it build your immunity?
Yeah,
and
yeah,
I will
yeah.
even add, how does it work?
Sure. Okay, so the typical vaccine helps your body to develop antibodies. So an antibody, the virus has these particles, and the antibodies are the ones that grab onto the particles so that they can't enter into the cell. So they just kind of neutralize the virus. And most of your body's immune system is around antibodies. Those are easy to measure in the blood, so when they do the studies, they'll give the people vaccine and then they'll test their antibodies to make sure they're generating antibodies. And if they have, that's a good sign there'll be protection. The other way is through something called cellular immunity. So you've got these cells on top of the antibodies, which are basically proteins that go around kind of covering the virus. There are cells in your blood, white blood cells, T cells and B cells, and the vaccine can help those cells, the T and B cells, to identify the virus and fight them directly cell to cell. And so T cells in particular are part of the immune response. They're harder to measure. Antibodies you can check in blood easily. But T cells, even when you don't have antibody reactions, sometimes the T cells can be enough to generate immunity. And absolutely, these two vaccines, the mRNA vaccines, Pfizer and Moderna, are fantastic at generating that kind of immunity.
Oh, that was a great explanation. I almost feel like we needed a whiteboard to draw that out.
Yeah. Now, I have a question. What are the, through the studies that they've been doing lately, I have not heard anyone talk about the side effects, right? With the studies that's going on, do you know what are the major side effects and what are the ups and the downs from taking the vaccine?
Yeah, great question. So most of the side effects are the sorts of side effects that you would get from getting a cold, where really it's your body's immune reaction that is causing the symptoms. And that's actually what we want. We want your body reacting to the vaccine. That's a sign that you're developing immunity and your body's learning to fight this off. So things like headache, fever, joint pain, muscle pain, feeling tired are pretty common, up to 50% of people, especially after the second dose, not as much after the first dose. And then, they'll peak on day 2. So day 1 tends to be not much. Day 2, you might feel pretty rough. By day 3 or 4, those side effects are past. There are no serious side effects with Pfizer or Moderna. We have seen some allergic reactions. The same way somebody might get an allergic reaction to a bee sting. You've seen that in a very small number of people. That's why when you get the vaccine, you've got to stay in the clinic for at least 15 minutes afterwards. We don't send people out, and if you're coming for an appointment, you can plan for that. You'll be there for at least 15 minutes after you get the shot, so that the nurses and the paramedics who are there can help anybody that has any kind of allergic reaction.
Okay. And do we...
Okay. Now my next question is, if someone have epilepsy, are they allowed to have the vaccine, or would that be a countermeasure if they take the vaccine? Would that affect them in any which way if they have epilepsy?
Not an issue. There really aren't many issues that would prevent you from getting the vaccine. Epilepsy, actually most of the healthcare conditions that you might have commonly are now eligibility criteria. So those, things like diabetes, asthma, epilepsy or other neurological diseases, even significant mental illness that's being diagnosed. As of today, we opened eligibility criteria to anybody in those categories.
Wow.
Pregnant women is another example, people that have had cancer, any kind of immune suppression, wide range of healthcare conditions will now make you eligible regardless of your age. So epilepsy, no problem. In fact, it's a good reason to go and get the vaccine even quickly.
Okay. All right. Thank you very much, Doctor. I really appreciate it. Thank you so much.
Thank you for your question.
Now I get to interrupt for a minute because we have some questions that are online.
Okay.
There's 2 questions online. The first of which is, are the vaccines safe for breastfeeding moms?
Yeah, for sure. The vaccines are definitely safe for breastfeeding moms. It's encouraged. The Society of Obstetricians and Gynecologists of Canada has highly recommended vaccination for anyone who's pregnant or breastfeeding. In fact, if you're breastfeeding, there's a good chance that getting the vaccine might help protect your baby as well because of the antibodies that can pass through the breast milk into the baby. So that's definitely a good thing to do.
The second question we're asked is, what allergies cause reactions when taking the vaccine?
Yeah, so it would be any kind of allergy to any of the components of the vaccines. Those would be extremely rare allergies, things that you'd probably know about because they would have been associated with some kind of allergy to a previous vaccine that might have similar components. There is one chemical that is in some makeup products that if you've ever had a reaction of a makeup product, you'll want to look into that. We screen everybody at the time of their appointment to make sure they don't have any of the relevant allergies. If somebody does have an allergy, they can still potentially get the vaccine. It's just that we would refer them to an allergist so it can be done in a safe place with proper medical supervision and consultation.
Okay.
That's it for now.
Okay, I wanted to touch on some of the questions that they had. So when it comes to the side effects, are these studies, because of how quickly it was made, and of course it sounds like there has been a lot of participants when it comes to the study, a variety of participants, but how do we know it's safe long term if there hasn't even been time to develop, to be able to assess and analyze the data of the long-term effects of these vaccines? Really? Is that a risk that we're taking?
Yeah, so I appreciate the question, and the answer is really around how much data we have because of the large number of people that we've signed up very quickly for these trials. And now, 6 months worth of data of vaccinating in the real world. The data around vaccine safety isn't just in the clinical trials. So we have these huge trials, 40,000 people in the trials, in each of the trials, but we also have around the world, you have systems that capture safety data from even after the vaccine's gone into the market. So let's say there was something that was missed in the trial. It gets picked up in those real-world studies because you're giving the vaccine now to tens of millions, hundreds of millions of people around the world. And that's how the blood clots associated with AstraZeneca came up, for example. When you look at vaccine safety and the history of vaccine safety, there aren't really long-term effects that don't show up in the relatively short term. It's just not something that has happened. And again, there are worldwide systems to track safety. Whenever there's any kind of adverse event, any kind of negative health impact after a vaccine, the physician involved is obliged to report that to public health so it can be investigated. And, as you can imagine, let's say in Canada we give the vaccine to all of the population, 35 million people. You're going to get people in any given week, they're going to pass away from various reasons.
Right.
So those deaths would get reported. If it happens to be, within a week or two of the vaccine, those deaths would get reported and they get investigated. And if the rate is above the baseline, well, it's a safety flag. We haven't had anything like that. With the exception of the blood clots, nothing like that anywhere in the world, and certainly not with any of the mRNA vaccines, the Pfizer and Moderna, which are the only two that we have in the mass clinics right now.
And when it comes to also just access to these studies, do we have access to the studies and how the studies were conducted and just that information? Do we as a people have access to that?
Yeah, so for sure. The Pfizer and Moderna studies, those are published in detail. You've got the US FDA data has been made public. And then the trials have also been published in the top medical journals, the Lancet and JAMA, the Journal of American Medical Association. So those data are available for anyone that wants to look at how the study was conducted. And then the safety data is also reported publicly as well.
Okay.
So that's why you're seeing today the provincial governments made a decision to hold AstraZeneca from being given anymore. Again, very minor, very uncommon side effect of blood clots, but they've just decided, we've got enough of these other vaccines. We don't need to use AstraZeneca anymore. Let's keep going, firing on all cylinders with the mRNA vaccines.
Okay. Another question on the
Well, we got about 3, so I'm going to get to the first one. It's with today's announcement of AstraZeneca being paused in Ontario and the supply issues that go along with it, how's that going to affect vaccine targets and goals?
Great question. It's not going to affect them very much, mainly because most of the AstraZeneca that was delivered to Canada has already been administered. So in Ontario, there were about 900,000 AstraZeneca vaccines that were delivered, and it's, the data that I've seen, it's between 700,000 and 800,000 have already been delivered. So AstraZeneca was never envisioned to be a big part of the Canadian vaccine campaign, and now that most of the doses that have been delivered have already been administered, given to patients, it really doesn't take a lot of supply out of the picture.
Okay. Next question is, if you had a reaction to the flu shot, okay, what would prevent you from getting further flu shots? Would you stay away from getting the vaccine?
Yeah, so there isn't a whole lot of crossover between the flu shot and this vaccine, but it would be important to talk with your family doctor. You could also, if needed, be referred to an allergist who could give some specialist advice about that.
And how effective are the vaccines against variants?
Yeah, so the variants of concern have really emerged over kind of the last 6 months or so. The UK variant was one of the first to hit Canada. Most of the variants that we've had here in Middlesex and London and across Ontario have been the UK variant. The variants are more a factor in terms of how COVID spreads more easily. We haven't seen great data that the vaccines are not effective against them. All the data we have show that they develop appropriate antibodies to all of the variants. We have more data around the variants that are more common, like the UK variant, and it's showing up that the vaccines, the mRNA vaccines, have been very effective against the variants.
Okay, and what about the variant from India?
Yeah, variant from India, it's really an open question right now. There isn't a lot of data in India with people who have been vaccinated. So we don't have a great answer to that question, but again, there's no reason to suspect that it wouldn't have at least some effectiveness.
Okay. This question was asked to me a little bit after the show last week, and it was in the form of, what effects does the vaccine have against your DNA? There's a few people around that they talk about it being able to alter your DNA and all that stuff, and I want you to clear up if there's any misconceptions, if there's anything. What exactly does it affect your DNA, and how does it affect your DNA?
Yeah, the vaccine does not affect your DNA. What it does is it brings into your cells the ability to produce the spike protein, which is essentially the flag for your body that the COVID is there. So you get the ability to produce the protein, which teaches your body how to react to it. And so it doesn't change your DNA at all. I got the vaccine in January. I haven't grown a third eye yet. But there just isn't any evidence at all that the vaccine changes your DNA.
And then with there being not enough, well, there's a lot of talk also of the amount of time that it's taken to, to the shortness of the time that it's taken to not only develop but put it out there.
Yeah.
There's concerns of 5 years down the road, 6 years down the road, 10 years down the road, we're gonna discover that that third eye, that third leg, that there's a lot of that also out there. What guarantees, and is there guarantees that 10 years down the road there won't be any serious side effects?
Yeah, so the reason it takes many vaccines years to be approved is because it takes people a lot of time to, first of all, recruit subjects into the vaccine studies, and second of all, to accumulate enough data, to gather enough data to show that there are, this rate of infection in the people that get vaccinated versus that rate of infection in people who don't. In this situation, it was very easy to recruit people. Everybody wanted to sign up for these trials. So you easily got your 35,000, 40,000 people into the studies. And then because we're in the middle of a pandemic. This virus is circulating a lot. So it was very quickly, you saw the difference between the vaccinated and unvaccinated group, where the vaccinated group was getting infected at a fairly high rate, and the vaccinated group was not getting infected, and the unvaccinated were getting infected at a very high rate. So basically, we were able to gather many years worth of data very quickly. The way, an analogy I would use is if you're building your house, you go and try and build your house by yourself. It might take many months or maybe even a year. You invite 40,000 of your friends over to help build the house, and you can do it in a day. And that's what we've done here with these vaccines. We've gathered enough data that it's equivalent to years of study.
Okay. And this question, I think Evodi and I talked about a little bit earlier. It's also come in. In the last week, there have been people talking about natural health. How does that fare against the vaccines? It seems that the conversation with governments worldwide, with health departments, it's get the vaccine, but they're not talking about all the other things that you could also be doing. They're also not talking about the side effects of everybody being cooped up, which is not being able to exercise the way they do, not being able to absorb vitamin D. We had a doctor on I believe about 3 weeks ago. We have a naturopath, and she does a show once a month, and she talks about things like vitamin D. And one of the thoughts that one of the facts that she brought up is that the sun, first of all, being able to go outside in the sun and absorb vitamin D, and vitamin D helps with your immune system, right? And people are saying, if you're cooped up, you can't exercise, you can't do this, then you're also helping the virus as opposed to helping the vaccine.
Great points. Vitamin D is definitely an issue. It's hard to get when you're not outside. Milk products in Canada do have vitamin D in them, so that helps, but it's a particular issue for people with black skin because it makes it harder to absorb vitamin D from the sun. That is definitely a concern. Exercise is huge both for your physical health as well as your mental health, and that's been a big loss, and especially for kids who are stuck at home and not able to go to school. That's been a major, major impact through the pandemic. And also vaccines and medicines make a difference too. So, I'm a believer in public health. We do believe in prevention. We believe in healthy living, in making sure you're eating a balanced diet. And also when we get a broken arm, we go to the hospital, get a cast on. That's the situation here. Absolutely, we want to do those healthy behaviors. We want to make sure we're getting enough vitamin D and also take those other steps like getting the vaccine.
Okay, and then my last, outside of you saying that here, the general message is vaccine. You don't hear, okay guys, you know what, those of you that are able to, I know we're in a lockdown, but try to, promote the physical exercise, like you said. A lot of immigrants, and I'm going to talk about once again from the black perspective, whether you come from Africa or whether you come from the Caribbean, we're used to being outside, we're used to walking, we're used to running, we're used to just being, I think on the whole we live a little bit healthier lifestyle in the sense of whereas in North America it became, in the last 10 years or so, you see everybody jumping on the health kick, but we, from we're born, we're up and we're out and we're doing stuff. So it's not something that we had to get used to or start or anything. We're just conditioned that way. And so now especially when you get into the older demographic and you start telling them, well, you got to be inside and you're going to be sick, and you're going to hear some comments, well, I was healthy, I was, but you're cooping me up and this and that and all the other aspects. And like I said, this message that you just said, the things that you just said, it's not being emphasized enough. And is that by choice? Is that because you just overwhelmingly want people to take the vaccine?
Yeah, it's a good point. And I think we could do better to emphasize the importance of exercise and being outside. Completely agree with you there. One thing that I can say is that we should be through this pandemic, or largely through it, fairly soon. Within the next couple of months, if we can get the rate of vaccination up to 75-80%, then we're going to have this largely under control, and we can get back to all of those healthy behaviors. You mentioned being outside and getting exercise, but gathering with family and friends is a big part of people's mental health as well. We've got to get back to that. Vaccine is part of the path there.
Those are the last of the questions that we have online. I'm just going to appeal to, once again, people, as you're listening to the show, if you have any questions, you can hit us up at evomm3.com. Just click Evo TV, log in, ask your questions, or you can call in at 519-694-3429. Back to my host, Miss Ivodi Mashangi.
I really like the analogy that you used when it came to how the vaccine works. And so now I want to ask, how does the vaccine work in your body after you've had COVID-19 and now you've built up those antibodies, or you have a strong immune system, and how does that affect when the virus gets in contact? So you gave the analogy of, okay, the vaccine creates these antibodies. I can't explain it the way he did, but but now when it comes to getting COVID, and how does the antibody work, and would you still need the vaccine if you had COVID already or tested positive? And then also when it comes to building a healthy, strong immune system, how would that work when you get in contact with the COVID?
Yeah, great question. So if you've had COVID, and actually any coronavirus, there are many coronaviruses and we have many years of experience with them. The immunity to coronaviruses that are naturally acquired, so that means through an infection, doesn't last very long. It might last for a few months, but then it wanes. You don't have as much immunity, whether it's antibodies or the cellular immunity. Same thing with influenza. That's why you got to get a flu shot every year. Part of it is that your immunity wanes over time, and so that's the case with the naturally acquired infections. Even if you've had COVID over the last year and a bit since the pandemic began, the vaccine will still give you an additional level of immunity and protection against any further infections.
Can you explain that more with an analogy? Because what I understood was as antibodies, your body now learns how to fight this infection. So how does it all of a sudden, 6 months, it doesn't know anymore? Whereas with the vaccine, it stays. So what's the difference between the two?
Well, it's I would see it as reminding your body how to fight this thing that you've already beaten off. It's not entirely clear whether the vaccine immunity will last longer than the natural immunity. Okay. It may be that even after your second dose of vaccine, you've got to get another one in 6 months. It may be that it becomes an annual vaccine. We don't know that yet. But at this point, we know that for people that have had COVID, the vaccine will really increase your antibodies and your T-cell immunity, and that can be measured in a clinical setting. It's easy to show.
Okay, and so when it comes to just off of what Collins was saying, there are people who are skeptical because of how they are bombarded with so much information about the vaccine, when as they wait for the vaccine, like our promotional video, we were talking to some youth within the community that their mental health, their overall health is really waning, and it's affecting them. And just that fear of, if I get COVID now, I don't think I'm strong enough to even beat it, So there's not a lot of information as you wait. I know you do have, I'm going to let you give some information on the news on who's eligible, but as we wait for all of us to be vaccinated, where do we go for information on how to build our immune system? Because without that information there, it's almost as if we're only being forced to make one decision. I'm not saying that people don't want to take the vaccine, but when they don't have enough information for them to choose, just like how if if I'm told this is your only option, I'll be like, I don't want to do it. Whereas I want to be able to make, we want to be able to make our own choices. As a mother myself, I'm looking at all the data. I'm getting as much information as possible, and I want to make the healthiest decisions for my children, not just for the future, but for right now. I want to live for tomorrow too, and the next day after that. Where do we go for that information to, in this quarantine time, during this lockdown, we are home? Where do we go for that information on how to just build our immune system before we can even get the vaccine, if that's what we want to do?
Yeah, so eating healthy, getting good exercise and rest all contribute to a positive immune system. There's nothing new or different about that. That's the same advice we would give people in any situation. I could tell you if there were some magic bullet, if yoga 3 times a day we're going to prevent COVID, we'd be recommending that.
Right.
We're definitely in that business. And of course, the public health measures about avoiding indoor gatherings with people from outside of your household, wearing a mask when you do need to be in public, all of those things we know do make a difference. And those are the things that people can re-emphasize with their families in the meantime.
Okay. So in a way, it kind of sounds like just wait for the vaccine.
Well, wait for the vaccine, but also, do take care of yourself. 3 meals a day, get a good rest, sleep well, and avoid gathering.
Right. But is there anything that the health unit can do to help us while we are waiting? Because that's why that I'm seeing a lot, especially with the youth. The youth are really going through it when it comes to stress, mental health, and all of this, causing them to become a lot more weaker also. Do you think there's anything that the health unit can do to help that, or is it just out of your hands?
Well, I wish there were. One thing that we're hoping is that schools can open sooner so that kids can start getting back, having some level of contact with each other. And start getting their lives somewhat back to normal. I think that would really help a lot of people, including some of those parents who are trying to help those kids with online school and also do their work. That can be pretty stressful too.
Yeah. Do you have children?
I do have 3 little girls.
How are you liking online school?
Liking is a strong term.
Right. Definitely challenging. We have another question.
Okay, and this question is the emphasis on servicing the black community. It seems that now and people are equating it to the fact of and we're going to go back to the George Floyd and all that stuff. It seems now there's an emphasis in all aspects of Canadian life, that they're placing emphasis on the black community. Now, when this subsides, what's there to say that the not only the Middlesex Health Unit or any other health units across Canada will continue to place an emphasis? And the reason this question is so relevant, and I'm glad it's being asked, is because there is a lack of trust in certain institutions. And even though the health department is supposed to be there's still a lack of trust there. So now there are people that feel that just because of the temperature of the moment, that's why, it's okay. We can pay attention to the black community and to marginalized communities now. But when history has shown that before that it hasn't really happened, what's to say that, okay, so we've gotten the vaccines, everything's back to normal, we don't need to pay attention to whether it's the black or marginalized communities?
Yeah, it's a really good question and a great point. I think that, the George Floyd moment was a really important moment for our organization and for many in Canada and around the world. What we're doing to try and make sure that our organization can stay interested, involved, and engaged in addressing those issues is that we're building that right into our strategy. So we're in the process, we've just renewed our strategic plan, and we've made addressing anti-black racism a core part of our strategic plan. So it's a core part of the Middlesex London Health Unit strategic plan. We've engaged an external consultant who's a black woman from Hamilton, excellent analyst who's done work with our community and looking at the experiences of people within the organization, We've also had another separate team of experts associated with Western University who are black people in this community who've given advice about what the Middlesex London Health Unit's role can be to address anti-black racism in the broader community outside of our organization. So we're doing our best, and those come with sets of recommendations that we can measure over time and report to the public on. So I would encourage you to stay interested in what is happening in Middlesex London Health Unit. We're going to be public about it all, and we hope that in a year or two from now, if we're not living up to expectations, that somebody can be asking tough questions and helping to get us back on track.
Right. That's what we're here for. We will hold you accountable.
And now I'm going to ask this question, and this is on behalf of not anybody online. This is an EVO question. How does the health department plan on addressing the lack of, I want to say employment opportunities, but it might not necessarily be employment opportunities. What it might be is more of people are not interested because, one, if you don't see somebody that looks like you, right, then you're not thinking health, let me get into this, right? And then when you see people like you, you don't normally see them in positions of higher than, in certain positions, I should say, in certain positions. And then you wonder, is it because they don't have the qualifications? Is there? And then you hear stories, and we're a new organization, but along the way, we're tapping into the stories that are in our community, and that's part of what we're about. We've done a lot of interviews. We have a show called My Community, and My Community taps into individuals in the community doing things. And a lot of the stories, especially in terms of education, the hurdles that they have to go through just to qualify, right? And I think it's not just from the black community. I think it used to be from Southeast Asia as well. You hear the stories, doctors, lawyers, Africa coming here, nurses, and they have to go through a set of qualifications. And sometimes it's just strenuous, and you have to suffer to get through. I know a nurse that used to work in St. Thomas, and she came here from South Africa, I believe about 30 years ago, and she told me of just the difficulties. And if it wasn't for determination and just trying to prove a point, she would have given up. And I'm going to say that's 30 years ago. But here we are now in 2021. What's being done to encourage minorities, whether it's the black community, whether it's the Asian community, whether it's the Aboriginal community, what's being done to encourage people and to enter the medical field, and not just PSAs or just really to go farther? Is there a recruitment campaign? Is there anything being and I should say that we should be targeted because we're the communities that need the representation. Yeah, absolutely. I think that, our organization has recognized the importance of representation. We have a history of success in this with our Indigenous Reconciliation Program. We were able to bring an Indigenous leader into the organization as a great representative. And we now have a set of recommendations from an external consultant who I mentioned, who is a black woman and an expert in this area and how to grow diversity within an organization. And those recommendations include things like making sure that you are expressly setting a goal of increasing diversity, making sure that interview questions don't have a cultural bias, making sure that there's a standardization to our hiring processes that don't generate some of those or reproduce some of the personal biases that many of us have without even knowing it, making sure that we eliminate parts of our hiring process that might require a certain type of degree when a life experience or work experience might be equivalent. So we have a set of recommendations that we're in the process of implementing on all of that, and I think it's well heard that no amount of talk or goodwill will replace representation.
Yes.
I just got to make Thank you for reminding me of the word. I was searching for it, so let me apologize. I used Aboriginal instead of Indigenous, and in this day and age, the word is, the correct terminology I should have used is Indigenous. I do apologize. Thank you, Dr. Mackie, for correcting me just by saying it, because I was actually searching for the word and couldn't remember, so thank you.
I want to, as we're closing out the show, I want to give you the opportunity to speak to now those who are ready to take the vaccine. Who's eligible right now? Where can they take these vaccines? When can they take them? And also, if you can speak a bit about our children. Do our children have to be vaccinated? Can they be vaccinated?
For sure. So right now, everyone older than 50 is eligible. As of Thursday, what will that be, the 13th of May, it'll be everyone over 40, so a big additional group. The following Thursday, everyone over 30, and then by the 27th of May, all adults, everyone over 18, will be eligible. In the meantime, we also have the large groups. I mentioned healthcare conditions. Anyone who's essential workers who can't work from home, which includes people who work in factories, people who work in restaurants, people teachers, taxi drivers, all of those essential workers who can't work from home are now eligible as well. That's as of today. So the easiest way to keep track of eligibility is at healthunit.com, the Middlesex London Health Unit webpage, healthunit.com. And we're following the provincial eligibility in lockstep now. So if you're eligible here, pretty sure you're eligible across the province. So check out healthunit.com.
Awesome, awesome. And to just end on a lighter note, I'd like to know, because obviously, yes, you are you're the medical officer of health and all that, but you're also, an individual. What is your biggest takeaway? What is your biggest lesson that between 2020 and 2021, COVID-19, the health unit, as a father, as someone within the community, what has it taught you?
Wow, lots of lessons, but the most important one is how important family is, how hard it is to miss them. I've been trying very hard to go see my parents at their place in Quebec, and every time we set that up, Thanksgiving we had the second wave coming, Christmas, same thing. We were supposed to at spring break get up there. Real missed opportunities, but looking forward to, my parents are vaccinated now, looking forward to seeing them as soon as we can.
Awesome, awesome. So that's all the time we have for today. Thank you so much for joining us. Thank you, Chris, for being here in the studio with us and answering all of our questions, our phone calls, our chats. We really appreciate it.